Hey, baby. Just give me a second. I need to take off all my wet stuff before I give you a hug. Yeah, it's a little wet out. There we go. Come here. I missed you. Were you worried about me? No, I knew that you were gonna worry. Babe, I grew up in a rainforest. This is nothing for me. It wasn't a tropical rainforest, so we didn't have any fun birds, but we did have lots of crows. Yeah, this is nothing. Yeah, I would say it's getting towards a torrential downpour out there, but that's why I have windshield wipers and good tires. You don't have to worry about me. I know you're always going to worry anyways, but it feels good to have somebody to worry about me. Come on. Come warm me up. Ow. Yeah, my knee's killing me again today. Yeah, I tried to keep off of it too much, but I had errands to run. It's really hard to do that when you're limping. I looked at the knee braces at the store, but I don't really know what kind I need. Do I just need one for like compression, or maybe like the support one? I don't know. But I did pick up a really nice ice pack, because normally I'll just have that one that you throw the ice cubes into. It's like one of the ones that you would see in movies and stuff when people would have a bump on their head or they would have a fever, so they would put it on their head. Yeah, I've got that one, but I decided to look for one that I could like strap to my leg. Yeah, so it has these two gel packs that you throw into the freezer, and then you slide it into the, I don't know, sleeve thing, and then it has the Velcro straps that wrap around. So I'm thinking I might be able to like actually move around and walk around when I have it on my knee. It's so annoying every time I like sit down, I have to get it into the right position and then just not move at all. And then I can't get up and do anything. Just like, what am I going to lean over and hold it to my knee as I'm walking? That's just weird. Yeah, I know. You want me to sit down and relax and have it elevated and not have to worry about moving around. But, babe, I can't put my life on hold just because my knees hurt. I know, but this happens too often. I know. But I do have a MRI coming up. Yeah. I think I told you, but I don't really remember. Yeah, so I went for the x-ray. That was like a month or two ago. And so they wanted to check out to make sure that there was like no fracturing, I guess. I don't know exactly what an x-ray would show for the knee. Maybe like deterioration of the bone. But they said that that was all perfect. It looked great. So now my doctor was thinking maybe it's, what was the word? The meniscus, I think it was. It's basically the padding between the kneecap and the other bones, the actual like joint part. So it's that padding that you have in there to keep it from being bone on bone, which is just gross. Yeah. So she thinks it's the meniscus might be slightly swollen or enlarged. Yeah. I should have written it down. Anytime we get to the like sciencey words, I'm just like, sure. Yep, that sounds good. That's why I need to take you. Yes, you'll be my memory for me. You'll remember everything they say, then I don't have to pay that much attention. Yeah. Like, I can just sit there and try to absorb it. Anyways, so she said that she thinks that it's just the meniscus is enlarged, and back in the day, they used to just do a surgery where they would just go in and take it out, which they now know is awful, because then you just have like bone on bone, and like I said, that's very disturbing. visual for me. But she said that nowadays they just go in and like shave it down a bit, which is also disturbing visual. Let's not dwell on that. Um, so she wants me to go in for an MRI to make sure that that's it, that there's nothing else going on. Because it's just painful. But I don't know, maybe it's the cold weather. I know some people like my dad who have any sort of like injuries or like joint issues, the cold weather can exacerbate it. So it has been pretty cold out lately. Who knows? You would think that because you want to ice it to help bring down like any inflammation or anything, having the cold weather outside might help, but I guess it might just have to do with pressure outside, barometers, whatever. Like I said, I don't know the science stuff. This is my very basic understanding. Yeah. Oh yeah, and I did pick up a couple like pain gels, like Voltaren or whatever that one is. And I picked up a different one, so I'll have to put that on later. Oh, you want to help me with it? I mean, I would absolutely love if you could help me with it, because your hands are always so nice and warm. And you usually end up giving me a nice massage whenever you do anything like this. Mm-hmm. Should I ice it before you put it on? Or should you like put it on and then wait a while and then maybe ice it? No, I'll ice it first. And after again. I don't know. I just want my knee to be okay. If it's like this now, what is it going to be like when I'm older? Oh, jeez. I mean, on the plus side, if I do end up getting a surgery to fix it, I don't want to talk about the details of it anymore, but if I do get a surgery, hopefully that'll prevent any issues in the future. I'd rather deal with it now than have it get worse in the future. Ugh. And it's much easier for me to heal with it when I'm younger than dealing with the surgery and the healing and everything later. And I have you to look after me. Mm-hmm. I know you want to play nurse. Mm-hmm. I will promise to be the best patient I possibly can. You already put up with me so well. Yeah. Yeah, I've had other surgeries before, so going into it, I don't really have any concerns. Like, I know I don't have the best reaction to the, like, how do you pronounce it again? The anesthesia? Anesthesia. I was just thinking anesthesiologist, but that's the person who does it. I don't have the best reaction to the anesthesia, but with my last surgery, I let them know that, and they gave me 2 different types of anti-nausea medication. And then when I was waking up, I felt a little bit of nausea. So they had this little, like, essential oils type thing. Yeah, I don't know. It smelled minty and good, so I don't know exactly what it was. But they opened that pack up and they put it on my chest so that I could just breathe it in. And it really helped. Like, my nausea went away right away. So there's little things that we can do to help with that aspect. But I've never had any other issues, so I have absolute faith in our doctors. Mm-hmm. I know you'll still worry, of course, but at least if I'm confident, hopefully that'll help you. I have enough confidence in them for the both of us. Yeah. Hopefully, if I do have it, they'll do it at our hospital here because we have a Starbucks. So while I'm in surgery, you can just go and get yourself a coffee. Oh, shut up. Of course, you'd be able to have something to eat while I'm being knocked out. You won't be that scared. Oh, that is very sweet of you, though, baby. True. If it was the other way around, if you were being knocked out for surgery, I would probably be climbing the walls. I'd be pestering the nurses every 5 minutes for answers and updates. They'd probably have to kick me out. Or get me like a straitjacket or something. I'm sure they have some extras lying around. Yes, just hope that you never have to have surgery or something. Can you imagine me taking care of you after surgery? I feel like I would just annoy you. I'd be all over you being like, "Are you okay? Are you sure you're okay? Do you need more pain meds?" I'd have an alarm set for the exact time that you would need to take any medications so that I would get them down your throat, even throughout the night. I actually did that for myself last time. Yeah, I had to take my pain meds every 4 hours. So I had an alarm set so that way I wouldn't sleep through the night and wake up and be in a ton of pain. Mm-hmm. Yeah, I had my tonsils taken out, and everybody kept telling me that it's some of the worst pain you'll ever experience, besides childbirth. Who knows if I'll even experience that. But yeah, they kept telling me how horrible and painful it is. But actually, it wasn't that bad. They did also give me liquid morphine to take for my painkillers. So, that helped, definitely. I don't remember much of that first week. I do remember it tasting horrible, but at least I wasn't in awful pain for my tonsils. Yeah. I don't know. I definitely encourage anybody who's scared of surgery, just do it. If it's going to benefit you in the long run, just do it. But I am very fortunate not to have a fear of surgery or anything. I do hate needles. I hate the needles. Ugh. Ugh. I know, I need you to hold my hand anytime I have to go get a blood test or anything. I don't know why. Like, I'm fine with tattoo needles. Like, they're still technically needles, but those ones are very superficial. So I'm fine with that. Also, because tattoos are badass, so who cares if you have to deal with pain and needles for a little bit? Yes, I'm definitely still getting more tattoos. Yeah, I have a few more planned out. But it's the intravenous, I think that's how you pronounce it. Those needles, like, ugh, something about them, they're just different. That's my one irrational fear that I've allowed myself. Spiders and whatever heights, I can deal with that stuff, but needles, nope. Nope, nope, nope. Which sucks because I've got health issues, so kind of have to deal with those on a regular basis. Mm-hmm. That's why I need you to go with me. I'll sit on your lap and you can just wrap your arms around me while they poke and prod me. Mm-hmm. Okay, can we talk about something else? Mm-hmm. Yeah. What else did I do today? Oh, I went to the store, one of the clothing stores that I really like. Yeah, I got some really cute pants and a new shirt. Both were on sale, of course, because I'm a sucker for a sale. No, I do actually like them. I have been getting very strict with myself. I think I need to go through my closet again, but I've been being very serious and realistic. Like, I don't have a ton of closet space, so I want to actually have clothes that I genuinely like and like how they fit me and like how they make me feel. I don't want to buy stuff just because it's on sale. But it is really nice when it just happens to be on sale. Mm-hmm. I'll have to try them on for you later. Do a little fashion show. Okay, okay. I know. You can wait till tomorrow. You don't want me hurting myself even more. Mm-hmm. I love you. You're always looking out for me. Yes. I don't know if I say it enough, but I truly appreciate you and everything you do for me. Mm-hmm. Every little thing, just things that come naturally to you. You don't even think about it, but it just makes such a huge difference to me. It just makes me feel so seen, so looked after. Yes, you're always my nurse, my protector, my knight in shining armor, my everything. Shut up, you're getting sappy. I mean it though. I'm absolutely serious. I appreciate everything you do for me. I can push myself too far. I fully accept that. I don't look out for what's necessarily best for me all the time. There's stuff that I know needs to get done, so I will push myself past the point of pain and exhaustion. And yet, when you're here, you just have to look at me to know that I'm getting too worn out, and you just tell me to shut up and go lie down. You just can tell. That's how I know that you're the one for me. You see me. All that sappy stuff, all that cheesy, romantic bullshit that we usually cringe at. It's all true. I'm not going to save it for Valentine's Day. It's not just for one day of the year for you. It's every day. And I try to be that for you in return. I don't know, it's just, as soon as that instinct came out for me with you, that's when it really sunk in that you're my person, my soulmate. It just came naturally. I didn't even have to think about things anymore. You send me a text saying that you're having a sucky day, and I just want to immediately go grab your favorite food and come home and sit in a blanket fort with you while we giggle and maybe watch a cheesy kids movie, because those ones always make us laugh and smile. Sometimes even cry, because Disney is a heartless bastard. I know, they know how to get us in the feels. But it's just automatic. Like, I don't even think about, oh, I should do something for you. It's just, I want to. It's just natural for me. Or I'll be out and about and I'll see something and just say, I know who would love this. So I'll snap a picture and just send it to you, hoping that it might make you smile. But I know that you'll appreciate it because I just know you. We just lay here and snuggle for a bit. Okay, I'll put the ice on my knee and then we'll lay here and snuggle for a bit. Yes. That's how I will slow down and rest myself, is if you're here with me. That makes it well worth it. Yes, obviously, bettering myself and resting is good, but you just make everything better. I need your good energy to soak into me and make me feel better. I don't even know how it works, just being in your arms. It's like it quiets the rest of the world and helps me recharge. I know, I'm talking nonsense now, but I just need you. Okay. I'll go get it. I'll be right back.